So hello guys, welcome to Nicomendic's Explorations. It's gonna be the ultimate destination for medical knowledge. And for those of you who don't know me, I'm Dr. Nicholas. Whether you are a passionate medical enthusiast or simply seeking entertainment, you have come to the right place. Today we will start the video with key important terms and definition, as well as some abbreviations that will be used along the presentation. So autoimmune disease is an immune reaction against the body's own cells. In other words, our body attacks our own cells and destroys them. Myasthenia means muscle weakness in Greek. Gravis means severe in Latin. Neuromuscular junction is the synapse between a motor neuron and a muscle fiber. We will see later a picture explaining this in more detail. Acetylcholine can be abbreviated as ACH. SLE stands for systemic lupus erythematosus. It's an autoimmune disease. EMG stands for electromyography. A test that will be used in the diagnosis of myasthenia gravis. This is a picture that you can see here: the spinal cord, the spinal nerve. The green line represents the motor neurons. This is the muscle fiber, and the area highlighted in yellow is the neuromuscular junction. So myasthenia gravis is an autoimmune disease of the neuromuscular junction. So it's an immune reaction against our body's own cells, as we said before, so against the neuromuscular junction. It is the most common disorder which affects the neuromuscular junction, because there are other disorders as well which are not autoimmune, such as Lambert-Eaton syndrome, which is a paraneoplastic syndrome of non-small cell lung carcinoma. As we can see here, myasthenia gravis can be classified into two types. The first one is ocular myasthenia, and the other one is generalized myasthenia. The ocular myasthenia, as it names, can conclude on its own, affects any muscle of the eyes, so the extraocular muscles which are responsible for the eyeball movements and the eyelid muscles. Now, generalized myasthenia can affect any skeletal muscle of our body, but the most common affected are respiratory muscles, ocular muscles, bulbar muscles, and muscles of the proximal limbs. In this picture, we can see a right upper eyelid ptosis, which is a symptom of myasthenia gravis. Moving on to the etiology. The etiology is that of antibodies against postsynaptic acetylcholine or receptor-associated protein are produced. Can be associated with other autoimmune diseases such as SLE, systemic lupus erythematosus, as we said in the beginning of the presentation, rheumatoid arthritis, Hashimoto thyroiditis, which is the most common cause of hypothyroidism, and sarcoidosis. Some patients have thymoma, which is a tumor of the thymus, and most of the patients, 65% of them, have thymic hyperplasia. It is important to mention that myasthenia gravis can be exacerbated by pregnancy. Describing the pathophysiology of myasthenia gravis, in the thymus there are muscle-like cells presented, which can also be called myoid cells, which express acetylcholine receptors. T cells target these receptors and produce autoreactive acetylcholine receptors onto antibodies, or simply called autoantibodies. Now, the antibodies target these postsynaptic receptors, and as a result, prevent acetylcholine binding on them and thus impairing the signal transduction. In this picture, we can see a representation of what we said before, starting with the blue part, which is the presynaptic cleft. In this case, is the motor neuron. The brown part is the postsynaptic cleft, which in this case is the muscle fiber. In the area between the arrows is the synapse, where neurotransmitters are released. Neurotransmitters are normally found in the vesicles in the presynaptic cleft and are released into the synapse once the presynaptic cleft is depolarized. And normally the neurotransmitters bind on the postsynaptic acetylcholine receptors. But as you can see here, number 3, which is the autoantibody, binds on the receptor, thus preventing the acetylcholine binding on it. So this impairs the signal transduction. Speaking about the symptoms, myasthenia gravis can be classified, as we said before, into ocular myasthenia and generalized myasthenia. ocular myasthenia affects extraocular and eyelid muscles, but generalized myasthenia, we said that can affect any skeletal muscles of our body, but the most common initial symptom in case of generalized myasthenia, because it affects more than one muscle group, it affects the eye muscles first, and as the disease progresses on, can affect the respiratory muscles, which can cause dyspnea, in the worst case respiratory failure, can affect the eye muscles, causing blurred vision or diplopia. It can affect the bulbar muscles, which can cause dysarthria and difficulties with swallowing. And lastly, it affects the proximal limb muscles, thus causing difficulties when climbing stairs or standing up from the chair. Moving on, some characteristics of the generalized myasthenia. It's the weakness, which worsens with use due to acetylcholine depletion. However, it improves with use, like the muscle use. The symptoms of myasthenia gravis have slow onset. It affects more the proximal muscles than the distal, as we said. There is no affection of the reflexes or sensation. There is normal autonomic function and normal pupil response, because iris sphincter muscle are smooth muscles, so they are not affected from myasthenia gravis, as it only involves the skeletal muscles. Coming to diagnosis, as always, the patient history is very important, and in such case of myasthenia gravis, the patient will complain for muscle weakness. In the blood tests, we can find anti-acetylcholine receptor antibodies, which are highly specific for myasthenia gravis. In the electromyography, we have decreased response to repetitive nerve stimulation. On chest X-ray or CT scan, we can find thymoma or thymic hyperplasia. And lastly, very important and very specific test is called the trophonium test, which, as we can see, is the administration of rapid-acting acetylcholinesterase inhibitor, which we will discuss later the mechanism of action of such drug, to access for symptom improvement. If it improves, then it's diagnostic from myasthenia gravis. Furthermore, a trophonium test can be used to distinguish myasthenia gravis from Lambert-Eaton myasthenic syndrome, because in Lambert-Eaton syndrome there is no response to cholinesterase inhibitors. In this picture, we can see the mechanism of acetylcholinesterase. So, as we can see, after the acetylcholine is released into the synapse, acetylcholinesterase, the enzyme which breaks down acetylcholine to acetate and choline, it inhibits such enzyme so that acetylcholine stays in the synapse, increasing its concentration in the synapse, thus improving the binding. Approaching the end of our video, it's time to discuss about the treatment, a very important aspect of every disease. The treatment of myasthenia gravis is rather symptomatic. It includes the following: cholinesterase inhibitor. The first line agent drug is pyridostigmine, which is indirect parasympathetic drug. Immunosuppressants as an alternative, for example, azathioprine. Thymectomy can be considered in case of thymoma or thymic hyperplasia, and plasmapheresis, which is used to remove the autoantibodies. Another drug that can be used is called rituximab, and the monoclonal antibodies targeting CD20 B cells. Now it's time for our quizzes. You may stop the video and think of the answer. The first one: myasthenia gravis is not associated with A. Thymoma, B. Thymic hyperplasia, or C. Non-small cell lung carcinoma. The correct answer is non-small cell lung carcinoma, which is associated with Lambert-Eaton myasthenic syndrome. The second question: in generalized myasthenia gravis, usually the first muscles which are affected are respiratory muscles, bulbar muscles, ocular muscles, or skeletal muscles. Correct answer is ocular muscles. Third question: serum tests during diagnosis are used to identify increased ESR, erythrocyte sedimentation rate, increased CRP, C-reactive protein, acetylcholine receptors onto antibodies, increased white blood cells, or increased thyroxine, which is a type of thyroid hormone. Correct answer is C, the presence of acetylcholine receptor onto antibodies. And the last question, pyridostigmine is a sympathomimetic, sympatholytic, parasympathomimetic, or parasympatholytic. Correct answer is C, parasympathomimetic, and specifically indirect parasympathomimetic. So guys, that's it. I hope you enjoyed the video. See you soon.